I think it's because of the link that they're taking some time. What do you say, Tasneem? Should we wait or should we start?
I think let's start, Anita. That's good.
Yeah. Okay. So, all right, everyone. Good evening, and thank you so much for joining us here today for another session during this health week. Today, it will be cultivating mental wellness, essential practices for a balanced lifestyle with Dr. Sayeda. Next slide, please. Okay. Just a little bit about Get Set Up. Get Set Up is on a mission to help those who are 55 years to learn new skills, connect with others, and unlock new life experiences. Our goal is to reduce isolation, loneliness, and equip the community with the tools and knowledge to age independently in place. Our community engages in classes online as well through offline activities, which is like traveling together over longer trips as well as short day trips. And about today's speaker, Dr. Sayeda is an experienced psychiatrist and psychotherapist specializing in adolescents, young adults, women, and families. Founder of Trellis Family Center, providing specialized care and support. She holds prestigious positions, including President-elect of Mumbai Psychiatric Society and Vice President of Indian Association of Biological Psychiatry. She's also actively involved as an advisor to Led by Foundation, Family First Guidance Center, and as a committee member of CIIIWN. So thank you very much, Tina. And I would hand over this session to Dr. Sayeda. Doctor, over to you. Let's keep it as interactive as possible. And also, all of you, please keep your phone on your Zoom on silent. And if you have any questions, you can please put it on the chat. We will definitely try and take everyone's questions. And if when there is a break or when Dr. Saida asks you a question, yes, you can unmute and answer at that time. Okay, you can highlight Dr. Saida now.
Hello. Thank you, Anita. Good evening, everyone. Lovely to be here. At the outset, I'm apologizing for my voice. So I've been struggling with a viral for the last 2 weeks, and my voice is still not recovered. So occasionally, if I cough, I'm going to apologize from before. Don't worry, I'm not infective, and I'm definitely not infective online. So we're all safe in that sense. Thank God for technology, isn't it? I was told that English is okay with everyone. I'm assuming that's still the case. Great, awesome. I'm still going to put my view as the gallery view just so that I can see more of y'all. I wish I had the time or the space to, just have you guys introduce yourselves so that I get to know you guys a little bit more, but I know that we are on a time crunch. So I'm going to go ahead and hopefully interact with you guys a little bit one-on-one when we are doing this. So I'm a psychiatrist. I love my field. I love my work. And the disclaimer is that again, if I start talking mental health, you can't pay me to shut up. So I am going to try and be mindful of the time, both yours as well as mine, because otherwise, yeah, too much of information is as good as no information, isn't it? Flooding is never a good idea. Um, I work with people, specifically younger people and families in my private, but with my general OPDs, I do see a lot of people who are older adults and senior adults. Of course, I have senior adults in my home, and I always joke about it, well, half joke about it, that raising an infant and taking care of senior adults is an extreme sport. And and it's my personal endeavor not to have that, not to become that when I grow older, and inching towards there. So hopefully, if I take care of my mental health now, and I'll do a better job when I'm older. I'm already old according to my young people in my family. So if I say, oh, use an expression that they might use, they're shocked and slightly disapproving. But overall, they tolerate me pretty well. I thought that instead of just giving like you guys a background about what mental health is and things like that, we would also maybe talk a little bit about what can we do not just for ourselves, but what can we do for people around us as well who may may require some help occasionally. So kind of gaining a new skill. Because especially when we're older, every new skill that we gain, every new information that we have, every new connect that we make, kind of in very simplistic terms, builds a new neural circuit in my brain. And the more circuits I have, the healthier I am. And the health, when I speak about health, I'm not just talking about mental health. I'm not, as we understand it, I'm talking about health in total. So that's something that we hope that we can do this today. So at the outset, I want to let people know what mental health actually is. Different people will have like a different definition and maybe even a different idea. uh, Simply put, mental health is something that I require every day. For me to figure out even a simple thing like, what do I want to wear today? What language must I speak in? Do I move my hands when I'm speaking? How do I learn? How do I, if I'm especially if I'm studying or whether I'm younger, older, how do I learn? How do I maintain my relationships? How do I speak to someone? If I'm angry, what do I do? If I'm happy, what do I do? If I'm bored, what do I do? Remembering to take care of myself, not only just to take my medications, but also not only just to eat well, sleep well, but also to how to interact, how to connect, how to, even if I don't feel like it, but improve and continue social contact. So all of those things, all of that requires mental health. It's not just what am I feeling and what am I thinking. It's all of these functions on a daily basis, and these functions happen in a very complex manner. It's an interaction of my brain with my body, that's an internal interaction, and my brain and body with my external environment, right? And how these interactions happen, how my brain interprets all of that, and then what is the outcome, and then what is it that I do, right? Even a simple thing like if you're smiling at me, that's my external environment, but the information goes into my head and my brain kind of like interprets it. Oh, is he or she happy to see me, or are they smirking at me and making fun of me? So all of that is a complex and a fascinating kind of interaction, and that's what mental health is. It's not just about I'm feeling sad or I'm thinking angry thoughts or negative thoughts. So essentially it's how we think and how we feel and how we behave, how we learn and make decisions, and how we perceive and handle everyday events or stressful events or happy events, and how we bond and nurture relationships as well. Um, uh, and also, mental health is a continuum. It's on a spectrum, right? It can go from wellness to illness. I could be mentally well and healthy, or I could all be having going through certain issues, or I could have an illness really. So it's a spectrum. I could have an illness and still be mentally well, or I could be absolutely normal and not have an illness, mental health illness, but I could still have a bad mental well-being. So again, this is something that the reason that I'm saying this is because we need to be okay with ourselves, and we need to be okay with people around us, and we need to accept that, okay, today I may be having a good day, today I may be having a okay-ish day, or today I may be having a bad day. And it's still me, and it's still me on a different spectrum. So that's why it's kind of like important. And my mental health is going to change, like I said, depending on my internal environment as well as my external environment. So if my internal environment changes, let's say I have hypothyroid, or I have any kind of thyroid disorder, or I have Parkinson's, or I have multiple sclerosis, or if I have something else, that is definitely going to impact my mental health. And there is a higher possibility of me having a mental health disorder, me having a mental health condition. If I have, because the reason I'm pointing that out is because most people will think that, oh, if something bad happens to me, only then can I feel sad. Or if something stressful happens, only then can I get anxious. But it's my internal environment that has changed. The biology of my body has changed. Those of us who've had periods in our lives, we've had PMS. A few days before our periods, there would be definite changes in the body, but also in the mind. There'd be maybe more irritability, sometimes even irrationality. Doesn't mean that those of us who had PMS would have a mental disorder. Some of us did. It's called premorbid dysphoric disorder, but most of us would have like a slightly bad few days. And some of us who've gone through menopause would have also had certain symptoms during the transition. So all of this is again something that is based on the internal environment changes. Of course, if there's an external environment change, I'm going to react to it. And those reactions, depending on what kind of change it is, how acute or how chronic or how sad or how, distressing, my reactions would be different. Um, and that's important for us to kind of like understand that it's not just that I could be feeling, if I'm feeling sad today, that means I have depression. Or if I'm feeling anxious today, that means either I'm an anxiety, anxious person, or I have an anxiety disorder. So it's important for us to kind of like understand there's mental health, that's everyday, regular, how am I doing? How am I, living my life? Then there are mental health issues. Suppose my dog died, or, I didn't get a promotion, or I lost some revenue or some money. I'm naturally going to feel upset. And depending on, like I said, the severity, if my dog died, I would probably be more tone up. Or for some people, they would be able to handle that okay. But if they lost money, they would not be able to handle that okay. So again, my ability or my reaction to a particular thing is also very internal and a very biological reaction. So to say that, oh, you shouldn't feel so sad, it was just a dog, or you shouldn't feel so sad, it was just money, or you shouldn't feel so sad because, fine, you'll pass the next time. That kind of gaslighting is not something that we want to do to ourselves or to others. Because what I can handle, probably, somebody else can't. And what they can handle, I probably can't. So again, it's very, when we actually think about mental health, it makes us more accepting for ourselves, about ourselves, and it also makes us more accepting of others. And we see our, hopefully, if I have a good mental health, I look at myself a little bit more objectively. I look at other people with more empathy, and I have more patience with myself, and I have more patience for others as well. So essentially, like if I just have to say that that's what mental health is. Of course, if I have
Dr. Saida, just a second. I know you have a bad throat, but I think people are not able to hear you very well because you're too soft or low. So if you can just increase your volume or something, let's see if that's going to work.
Uh, okay, I'm gonna
Right?
try.
Yeah,
Um,
you could just talk a little bit louder.
all right. So I think my volume has been okay with my one-on-one sessions with my patients, but maybe not for today. So I really apologize for that. I'm gonna try and get a little closer to the mic here, and hopefully that helps a little bit as well. Right. So I was just like, saying, giving you a background of what mental health is and how it's a spectrum, and how, all of us, one should be able to look at ourselves and accept ourselves for who we are so that we can also accept other people. Um, Sometimes it's easier to accept other people first and then accept ourselves. But the whole point is that we don't want to be harsh on ourselves. We want to be compassionate towards ourselves. We also don't want to be harsh or compassionate or judgmental about other people. And that's essentially is what's going to bring peace to me. So when we say, oh, be happy or be positive, that's what we're looking for, isn't it? That kind of peace, that kind of contentment. It's not exactly like a ha happy. I should be able to enjoy what I'm doing. I should be able to focus on what I'm doing. That's mental health. That's where we want to be. Uh, some of us may have had better mental health before, not so much now, or some of us may actually have had not such a great mental health before, but enjoy a better mental health now. And and we need to figure out how to do that. Because we talk about resilience, right? We talk about, oh, if I'm a resilient person, I can bounce back from adversities, whether those adversities are in life or whether those adversities are about, like a physical ailment. If I broke a bone, or if I have if I have diabetes, or if I have something that I'm recovering from, like a flu that I'm recovering from. So people tend to think of resilience as only something of the mind and of the spirit. But I'm telling you that it's actually a physical function of the brain. So if I have a healthier mental health, my resilience improves. And if my resilience improves, of course, I'm going to have better immunity. I'm going to have, faster recovery. I'm going to be overall healthy, and not to mention possibly even live longer. So when we say mental health is important, frankly, it is very, very essential. Because even if I'm physically fit, but if I'm mentally not doing very well, I'm not going to feel fit. I'm not going to be able to enjoy my health. So it's not just a state of mind, but it's something that I require for not just my everyday functioning outwardly, but for my body to function, right? When we talk about circadian rhythm, my sleep awake cycle, am I sleeping in the night? Am I awake in the day? What's my body doing in terms of temperature and heart rate and breathing when I'm sleeping versus what it's doing when I'm awake in the morning? So all of that is mental health as well. And if my mental health is okay, then all of this is also okay. Um, Now that we've established mental health is so important, and mental health is important for us to live a normal life, but for us to appreciate who we are and what we have, and just find that contentment in our lives. And it's so important for our physical health as well. I think it's, if we talk a little bit about also that, y- what might be a mental health first aid. We know physical first aid, right? We know, oh, if I get a cut, what do I do? If I get a burn, what do I do? If I have a severe burn, which doctor do I go to? If my blood pressure is rising, what do I do? If my blood sugar is going low, what do I do? So all of these first aid tips is something that we know from a physical aspect, but there's also mental health first aid. And the reason that we need to have mental health first aid is because there one in five people, one in five of us has had some mental health issues sometime in our life, right? So many of us in the meeting today, and we've had most of us have had some issues or the other. And mental health is such an invisible entity. A mental health condition is such an invisible entity that most of us might not recognize it. So, A, it is rampant. B, most of us don't know what to look for. See, we have such less information about it. And more specifically, and unfortunately more seriously, there's so much stigma attached to it. If I say that I have depression as a disorder, or I have schizophrenia, or if I have something else, I'm looked at as if, oh, I'm weak-minded, or even cursed maybe, or my upbringing was wrong, or I and my family will get looked at with suspicion that what's going on in their home, that's why she has depression. So it kind of like, there's so much of stigma and shame around it. And that's why we don't, I think, really come out and take care of ourselves. And we don't do as much in, like, we might even prevent ourselves from looking at others from that point of view as well, because no, 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 I don't want to intrude and I don't want to see, right? And that's why mental health first aid is important, because it's important for us to learn how to take care of ourselves. And of course, we want to be taking care of the people around us. At different age, I'll have a different purpose in life, right? But if I'm alive, I have a purpose. I may know it, or I may not know it, but if I'm alive, I have a purpose. And maybe this is something also that I could be purposeful at. So this is something, that's why that, we say that mental health first aid is helping a person who is developing a mental health problem or is in a mental health crisis before they can reach a professional. And first aid is so important that all of us know about, isn't it? And it's also about if I'm providing mental health first aid and my attitude towards providing that mental health first aid is good, then the person who's receiving first aid has more trust in the process and will actually go to a professional and get that help. Because even now, with so much of talk about mental health, when people have an illness, and even when they know that they have an illness, they will not reach out for help. They will not take treatment because of the stigma around. And we definitely need to normalize it. And frankly, the world changes because of the young and the old. So I think, at both spectrums of our ages, we are more powerful. And that's why we need to kind of bring about that change in ourselves, because we all know, talking the talk doesn't help, walking the walk does help. And that's how other people learn about it as well. So at this point, I'm going to ask people if they want to share some stories about maybe about themselves, or maybe about, people that you may know. Have you seen somebody that you feel may have had a mental health issue or a disorder? What do you know about anything? So anybody wants to share a few experiences or share a few stories, I would definitely want to know that.
Yeah, if anybody would like to share, please raise your hand and I'll unmute, or you can unmute yourself and share. Anyone? Okay, there's someone who wants to know first aid for mental health.
Mm-hmm.
She's asking first aid for mental health.
Right. I think Miss Rita Bose is raising her hand, but like she hasn't pressed that icon, but I can definitely see her hand raised.
Okay, you can unmute and speak.
Yeah, I just want to know a person suddenly she's in a common environment and suddenly she just feels like crying. Mane, she just breaks down and just wants to cry. So is it a depressive state of mind, or what exactly? Mane, everything is normal around and suddenly she feels like, oh, she just breaks down and starts crying. So, what would I say about such a person?
Thank you so much, Ms. Bose, for that question. That brings, it's a very good segue for me to kind of tell you, how do we recognize if we have a mental health disorder, right? So if there is a change in my pattern, if there is a change in my pattern of thoughts or feelings, emotions, behavior, uh, life life pattern, right? That maybe I'm sleeping too much or sleeping less or sleeping at weird hours, disturbed sleep, I'm not eating enough or I'm eating too much, I'm feeling irritated or sad, or anxious or crying all of a sudden, or I have these thoughts that are negative, or my thoughts are just constantly running and they don't stop, and I'm overthinking, or if one thought gets into my head, I'm just ruminating about it again and again and again. If there is any change in these patterns, right, that I have noticed or people have noticed within me, and this pattern has been like, for more than 2 to 3 weeks, and more days than not, there's this shift that wasn't there before. There's a possibility that I may be suffering from a mental health condition. What that mental health condition is could be anything. So, like you said, that everything is fine, everything is okay. There's no trigger in the environment, life is okay, but all of a sudden there are crying spells. Now, if there are crying spells, especially if there is no trigger, we definitely need to look into it. So what a psychiatrist will do is, or a general physician for that matter, they'll take your history, they'll see what kind of symptoms there are, they'll also see what kind of medical illnesses you may be having, or screen for them, like diabetes and definitely thyroid disorders and definitely other conditions. Hemoglobin is so important. Vitamin levels are so important. So we'll screen for all of that, what might be contributing to these symptoms. And if we have an understanding, and if we have an understanding of that, maybe then we have a diagnosis. Not everybody is going to have a diagnosis. Some people may be just going through an adjustment period, which may last for not just 2 to 3 weeks, but maybe 2 to 3 months as well. Like suppose if, I I lost a domestic help that my staff was with me for some time. Now they've retired, maybe. Or, like I said, a pet died, or a child moved out and have moved away, and there's empty nest and things like that. So all of those things could be adjustment periods where I might have these symptoms for a longer period of time. So not everything is a diagnosis, right? But having said that, again, that's why I said that there's a difference between a mental health issue and a mental health disorder. Now, the reason that we have that difference is we understand that difference is because if it's a mental health disorder, we definitely need a better treatment plan that may or may not include medications. It will definitely include some lifestyle changes and adjustments, and it will also include some amount of therapy, depending on what kind and depending on the person's personality as well. If it's a mental health condition, usually medications are not required unless and until it's like for a short period of time, for a week or 10 days here and there, things like that. So when there is consistent change in patterns of thoughts and behavior or sleep or appetite or weight or focus, and that's when we definitely need to look into it, that maybe something's happening, right? But even if I have depression, I could very well just break into tears, or it may just catch me unawares. Again, I don't have to be, I don't have to have a trigger that is visible to others for me to feel sad. I don't have to have a trigger that might be very obvious that, oh, my boss yelled at me, for me to have a panic attack. Because if I have a disorder, I may not always have a trigger. If there is a trigger that we can identify, great, then we can have some kind of problem solving approach towards it. But it can also tell us what the pattern is like, right? So that's why I started with explaining what mental health is and how the change in environment can trigger symptoms. And it's not always that if you're crying, that means you think your life is pathetic. No, you could be crying, and at that second, you could be feeling very sad, and you know that your life is good. So, like, I give examples to people. Just because I'm feeling something right now doesn't mean that just because I'm feeling sad right now doesn't mean my life is bad or my life is pathetic. So those simple distinctions, when we draw and we understand, that makes a difference between me having a good mental health versus me not enjoying a very good mental health. So I hope that answers a little bit more than your question, or at least some of your question. And if you do know somebody who is, getting crying spells, maybe they need to go check with their doctor or maybe see a psychiatrist.
Okay. Thank you, doctor. Thank you. Thank you so much.
Thanks. So do you want me to, because I think a couple of times the first aid tips have kind of come up again. So I'm just going to quickly, I wish I could have shared some slides, but that's all right. So a mental health crisis could look like a panic attack. Somebody who has a panic attack can have a lot of different kind of symptoms. They can have breathlessness, they can have palpitations, and the chest is beating very fast. They could be sweating, or they could feel hot or cold. They could feel faint. For some people, it feels as if they're having a heart attack. For others, they get a dizzy spell and they feel they might fall down. So panic attack or an anxiety attack can be a crisis. And at that minute, we need to help them. Ideas of suicide, that life is not worth living, or I want to harm myself, I want to kill myself, I want to end my life. That's a mental health crisis. Also rage. A lot of the times people get into these rages and they can, be very, very angry, and that could be very disturbing and dangerous for people around them and for themselves as well. And that could be a mental health crisis. And of course, if somebody has a psychotic episode because of multiple medical conditions, that's also a mental health crisis. When of course, if it's like very, if it's a rage, or if it's something, a psychotic, not much we can do beyond seeing to it that that person is as safe as possible, and we can take them to a professional as soon as possible. Then there are other aspects, like if there is a panic attack going on, right? We could also learn that, okay, how do we first figure out what's going on? It's not our job to, like if I'm not a psychiatrist, it's not my job to diagnose, but I need to also learn what to look for, what signs to look for, so that I can help them, right? Uh, um, um, uh, and there are a lot of do's and don'ts in mental health. But the first thing that we definitely want to know is improve our mental health literacy. And like we just described, various symptoms that could be there, right? Of depression, of anxiety, of distress, of suicidal ideas, of feeling purposeless and having, no meaning in life. And loneliness is a very, very big a symptom, but also a cause of issues. So when we understand these things and we understand and we look at it from from an empathetic point of view and not a sympathetic point of view, these are one of the prerequisites for us to even have even learn mental health first aid tips. Because when I'm looking down at someone, or I'm looking at someone as if they are less than me, then we are not be going to be able to provide that help and care that one would want and one would expect and one would hope for really at that minute. So it's important for us to learn all of these symptoms a little bit more. And the way we learn mental health and the way we learn therapy is that we go through that ourselves so that we understand the process better. So that's why taking care of my mental health is so much more important, so that I can help take care of other people's mental health. So it does definitely start from there. Something called active listening. Active listening is where you are definitely present for that person, and you may have eye contact and you're there and you're listening to what you're saying instead of only figuring out what to say to that other person. And not just listening with your eyes, not just listening with your ears, but also listening with your eyes and what the body language is like, and and making your body language more receptive and more comforting and more easy, so that they might mimic our actions and they might also feel a little easy with themselves. So active listening is one of the first prerequisites, one of the first tips of mental health first aid. Um, uh, Especially if somebody that they might be saying that, oh, these days I don't think that life is worth living, I feel, I don't know, I hope it ends soon, or I might want to end it soon. So that's definitely when you want to see that, are there more red flags, what's going on, right? And because suicidal thoughts are a medical emergency, just like a cardiac arrest and just like a diabetes a crisis. It's a medical emergency, and we definitely want to be prepared for it. So there are a lot of do's and don'ts really that come with mental health first aid. So ask if a person requires assistance before just assuming and giving it to them. Don't use derogatory words like, are you crazy? Like, oh, you don't talk like a crazy person, and what's wrong with you? Oh, you're being so weak. So these kind of labels are something that are definitely not helpful at all for any kind of conversation, let alone a mental health first aid. We definitely have to respect the person, not judge them, like I said, be active and empathetic listener, and not judge them or the people around them. Because even while I may be complaining about my people to you, I definitely still feel loyal enough and maybe even guilty that I'm complaining to you about my people. So I definitely want to be empathetic when I'm listening to somebody else complain about their people. And I'm definitely don't want to say, yes, 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 those are awful people. And yes, your mother-in-law is awful, your daughter-in-law is awful, you should leave your husband, he's horrible. So we don't want to say such things. We want to just listen to what they're saying, because they're trying to just maybe unload a little bit. We want to definitely try and avoid telling them what to do, because again, when you're putting yourself in a position of power, that's not what we want. We want to put ourselves in a position of equal but calmness, so that they also feel a little calm. And telling them what to do might in fact be the wrong thing to do, because if I feel that, oh yes, I should try and distract myself, but I'm not being able to distract myself, then you tell me to distract myself, then I feel more pathetic. That, see, this is what I'm supposed to do and I'm not being able to do it, I'm so pathetic. So we definitely don't want to underline the negative thoughts that I may be having, right? So we don't want to do that. And we don't want to invalidate what they're saying, that, oh, you're just making it up, or, oh, you're doing it for attention. Those are definitely things that are very, very hurtful, not just to the person at that minute, but hurtful to the entire process of health. Because even if I am, suppose if I'm doing something for attention, that should also tell you something, isn't it? Why do I need so much of attention? And why can I not just simply say, I'm feeling sad? Why do I say things like, oh, why do I get these headaches and this tummy aches? Because we allow ourselves to express physical discomfort, but we don't allow ourselves to express mental discomfort. Those are the reasons also we want to be empathetic and be gentle and ask what's going on. Can you share? Do you want to share? How do you think I can help you? These are simple things that we want to kind of like learn these language, learn these words, so that we're not alienating them. We're not making them feel as if I know better, or you are weak and I'm strong. We want them to know that I'm there for you. We're there for each other. We'll help each other out, and that's what is going to help them feel better. And then we empower them by saying that, okay, let's go see a doctor, let's go see a psychologist, let's go see a general physician, a family physician. I can come with you, I can help you make an appointment. So those are the things that we want to tell them. And we don't want to say things like, oh, just stop feeling sad, or oh, just stop overthinking. Because if they could have done it, they would have done it. So we definitely don't want to insult someone's intelligence by saying it that you're just overthinking it, or you're just over dramatizing things. We definitely don't want to do that. So few do's and don'ts in terms of changing how we talk to each other. And instead of like, just saying that, yeah, I think you have depression. We definitely don't want to do that. And I like jokingly, but only half jokingly, I tell people, if you say something, that's labeling, but if I say something, that's diagnosis, because I'm the professional here. So these are things that we definitely want to know. Suppose if it's not a crisis, but suppose you're talking to someone and they are not feeling very great, right? And so what can you do? First, you need to self-check. Am I okay? Am I okay? Am I feeling all right? Can I be there for someone? Do I feel I have the social battery to be able to speak to them? Or do I feel that I have the time or the empathy right now to listen to them? If I feel, yeah, I'm doing okay, then I can be there for others. I just finished speaking to a 19-year-old. She's in Australia studying right now. And she was like, oh, there's this another friend of mine. He was also going through diagnosis. So he and I would speak to each other, but he all of a sudden just disappeared. I don't know what I did wrong. So I was teaching her how to ask for help. So, like you have to first ask them. Like if I am asking for help, I should ask them, hey, listen, do you have the time? Do you have the capacity? I just wanted to vent a little bit, or I want to complain, or I wanted to talk to somebody. And I want my friends or the people that I reach out to also to know that, hey, I'm really sorry. I know you want me to be there for you, but right now is not the good time. Do you have somebody else to speak to? Or can we talk tonight, later tonight, or can we talk tomorrow? So this is what we need to learn how to interact with each other. So first I need to do a self check, and then I need to ask the other person. It's a simple rule of H. Do you want to be helped? Do you want to be heard, or do you want to be hugged? Right? So if it's like for a couple, I would generally say, is this a listening session or is this a problem solving session? So if I'm going and complaining to my husband about my in-laws maybe, or about my mother maybe, and I just want him to maybe listen, right? So if he knows and he asks me, are we listening or are we problem solving? And I tell him, no, we're just listening right now. So all I want him to do is just sit there, listen, and I want to know that he's in my corner, right? I want to know that he's got my back. That's all I want. If I want, because if he starts giving me things to do, or, oh, you should say, speak to this person like that, and you should do that, that's frustrating to me. So the same way, like, are we listening or are we problem solving when we are two people interacting? If I'm suppose like, trying to be there for someone else, I will ask them, do you want to be helped? Helped could be, that's how we deconstruct a problem and maybe come up with a solution. Oh, your staff is harassing you in this manner. Have you tried to do this? Or what have you already tried? Because again, we don't want to make the other person feel that they need help. Our job is to help empower them, right? So when we are asking, what have you already tried? That makes me realize, I've already tried a couple of things and they didn't work, because otherwise I was feeling helpless. Okay, I don't know how to deal with this situation. So when when these are simple, small, little change in our vocabulary that makes a lot of difference between me getting advice versus me helping myself. And if you can be part of somebody who helps me help myself, I like you more. I like you better because you don't make me feel less than you. You make me feel more empowered me. So how do you, if I want to be helped, if I want to be heard, just again, active empathetic listening. The difference between me venting and me complaining is the listener, right? So if I am going to just vent and you're listening, that's probably all I need. But you know what? I could also be going on and on for a couple of hours. And that kind of rubs off, that kind of negativity also rubs off on you. So you need to again do a self check. And then you might want to also say that, I think there's so much more that you need to unload. How about we talk about it again? Because I don't think this is going to get fixed or get better in just one time in one talk. So you might want to gently but definitely put that to a stop because that's affecting you. Because if it's affecting you, we definitely don't want you to be a martyr because you're not helping yourself and you're definitely not going to be able to help that other person. And if I have to listen to somebody 2 hours every single day just venting, I might start resenting that person instead of trying to help that person, right? So we definitely want to keep self-checking when we are offering some kind of help. And the third thing is, do you want to be hugged? Hug doesn't necessarily only mean like a bear hug. It could be just sitting holding hands. It could be just sitting side by side. It could be just holding eye contact. It could definitely mean hugging each other as well. Physical contact is something that's very soothing and calming to human beings. It improves bonding. When I'm even holding hands with someone, that increases my oxytocin. So all of these things are definitely very helpful for that person. But we definitely want to remember that if we are not a professional, this is not our job to fix anyone. We're just tiding them over so that they can get the help that they need, because otherwise it is too taxing for you to be able to do this time, day in and day out. Having said that, some situations are not that easy, but hopefully we can be optimistic and we can be there for as long as it requires for them to then take help if that's what they need. So I know that I spoke a lot, and I hope that some of it is something that is easy for you to retain. In terms of how to help, but if there's something that you want me to repeat, I'm more than happy to do that. And Yeah, somebody put that: heard, hugged, and helped. Thank you so much, Nirmala Prabhu. Nirmala G Prabhu. Sorry, I'm sorry if I'm pronouncing your name wrong. So definitely that's something that we can. If we practice this, how do we talk, what words do we avoid, then it becomes more permanent, right? Instead of just saying that I think you should do this, you might want to ask, have you considered doing this? Do you think this might work? Because again, like I said, it's about empowering that other person instead of I know better. Oh, just because I've been through something like this before doesn't mean I can give you the advice now, because that was me then in my life. This is you now in your life. And even if we are siblings raised in the same house, we are very, very different. So these are simple, small, little things that if we kind of practice a little bit more, we'll be able to better kind of facilitate and help people around us. And like I said, self-check is very, very important. And if I see other people doing that self-check, I might also start doing it. So again, walk the talk and not just talk the talk. So when we say that, okay, professional help, even if there is, some kind of like issue. So what does this professional help look like? Like I was saying that maybe a family physician is the first person that we go to and maybe share our issues. But we also want to ask our family physician, does this require more help? Because a lot of the times the problem, especially with older people, is that even healthcare providers might think that, oh, some amount of sadness is just common with old age. No, it's not. I could be old, I don't need to be sad, right? Oh, some amount of forgetfulness is common with old age. Again, not necessarily. Or we definitely don't want to just take it for granted that, oh, this is aging. or because, we definitely want to do healthy aging. We don't want to let ourselves go in terms of not just physical appearance and physical fitness, but also mental appearance and mental fitness, right? So we definitely want to ask that. I'm feeling this, thinking this. These are the changes I've noticed since such a long period of time. What do I need to do about it? Because especially the older we get, the same way that when you're very young and when you're a child, we don't want to over medicate. We don't want to overcorrect. We don't want to give too much of medicines. In fact, most psychiatrists, when we first see an older adult who's, especially when they're 70 plus, we're trying to reduce the medicines. We're like, okay, what can we cut down? What can we reduce? Because all of that is impacting us. So it's not about that. And a lot of times, family physicians can also probably prescribe something which is absolutely good for you, but not tell you what are they prescribing for. So that again doesn't empower you to take care of yourselves, right? A lot of times people will come to us, the family physician has been giving the right medicine and the right dose, but they haven't told them that they've been taking medications for depression or anxiety. So and then the person feels a little betrayed by their family physician, also because they're like, if my if my doctor would have told me, I would have done something more about it. So you also are responsible for your own care. So if you're going to your doctor, ask your questions as well, right? If you know that you definitely, if you or someone else requires mental health care, right? Again, depending on whether it's a issue or whether it's an illness, we might want to go to either a therapist, a psychologist. They can be a clinical psychologist or a counseling psychologist. They'll at least have an MPhil or a PhD, in some cases even in only an MA master's degree. A lot of people do practice it like that as well. There definitely a psychiatrist who is able to diagnose, if there is a diagnosis, and then plan a treatment plan, which may or may not include medications, and will definitely include certain kind of lifestyle modifications, and also whatever kind of therapy that you might require. So a therapist might not always know the diagnosis because they're not equipped to diagnose, but a psychiatrist will know how to diagnose and what to diagnose as well. So there are small differences like that. So anytime that we are taking any kind of medical care, health care, or paramedical care, we definitely want to know who the certified, qualified people are, so that we help ourselves instead of creating another set of problems. And contrary to popular belief, psychiatric medications are very, very safe when taken properly in the right dose, and etc., etc. Most people who are addicted to medications are not prescribed by psychiatrists. They were probably prescribed by a family physician or a cardiologist or something like that, and they've just been taking that medicine for 20 years. And of course, now they're addicted. So, so the addiction is not something that we see commonly with most psychiatric medications. There's some medications that are used by different doctors as well that could be addictive. So it's like that. And unfortunately, people will come and say things to me that, oh, once you start these medicines, you can never stop. Oh, that's not true. That's not true at all. And I have a lot of patients we've put them off medications, they're doing well. Having said that, even if you do require medications for a long period of time or for a lifetime for that matter, isn't treatment better than illness? Isn't taking care of yourself, fixing the problem better than suffering it? And I mean, if you have diabetes or if you have blood pressure, you're not even going to blink and just accept that you're going to take medications lifelong. So what's the difference here? And that's why understanding mental health is so important. Destigmatizing mental health is so important, because just like depression, diabetes, blood pressure, they're all coming from the same genetic pool. They're chronic non-communicable disorders. So if we're okay to treat one disorder, why are we not okay to treat the other disorder? Because frankly, if you treat any disorder that gets untreated, it's just going to get worse, and it will also trigger other things, right? If I have like a little bit of depression and I don't take care of it, I might be risking dementia later, right? I might be triggering diabetes, which may have happened maybe 10 years from now, but because of been untreated depression, it may get triggered now. We don't know that. So you definitely want to look at yourself holistically. and not just, oh, physical illness is okay, mental illness is not to be looked at, physical illness gets treated, mental illness gets, ignored. We don't want to do that. And we want to encourage other people also to look at themselves more holistically, right? If spiritually I feel not happy, I'm not going to feel very great. I was just speaking to earlier in the day, and MD Gynac, and she was like, I don't feel attached to God anymore. I used to feel very connected. And that's not making me feel very happy. And that's also making me feel scared. What if I just lose connection with God? So even spiritual health is so important, because all of this, the holistic viewpoint of ourselves, is what's going to make a difference between a quality life and not so good quality life.
Dr. Sayeda, can we take a question? Because I think Nirmala's raised her hand for quite some time.
Sure.
Yeah, Nirmala, you can unmute and ask.
Yeah, such a wonderful session, doctor, and everyone faces with some sort of a, I won't call it a mental health issue, but something where we don't know where we are, because in today's world, on the WhatsApp, people are more worried about what others are saying than what they are saying. And any little comment or something gets triggered or whatever. And you are facing so much at home, where the generation gap between you and your children have increased. And when you're looking for a sort of a company where you want to get with your age people, you don't know whether you are in the right place or not. So my question to you is that, because of very less social interaction between people, how can we at this age, be uh, at because we cannot go out very often, we have a lot of restrictions, etc. How can we at this age be in that social circle, because children are on their own, and the generation gap is very big. Sometimes, we get to hear from our children that our parenting is wrong and we are wrong, when we even as grandmothers and everything. So that actually becomes a sort of a labeling for us. So sometimes I just keep wondering, did I do the right thing all my life, or was I always wrong? I mean, even if you want to say something, people are not open to taking any uh, even your opinion from you. I mean, they just want to label you, they want to tell you. Recently, I have been seeing, people are even straight away giving comments like no one's business, just labeling you on a group. How do you manage that part of it?
Yeah, doctor, we just have 2 minutes left.
Okay, so I'm going to try and answer quickly. First of all, WhatsApp University, the worst thing to happen to all of us. I think everybody, including all professionals, will agree to it. Second of all, if you are in an environment that's not supportive and is name calling and is toxic, please leave. Because nobody deserves to do that. No matter how great a parent we are, our children are going to hold some grudges against us. That's a given. Even though I love my parents, really respect them, even today, they're very elderly and they're still there for me and all of that, I still have things that, oh, they didn't do this right, and oh, they did this right, or if they should have done that differently. Even when I'm so old, I will still have a grudge against my parent, even at this age, right? So we need to kind of accept that a little bit, that it's all right. And of course, I hope that I learn from other people's mistakes before I even learn from my own mistakes. So, but I am going to have to accept the fact that I did a good job at that time, given whatever knowledge, information, capacity, resources I had. And if I do think that I did mess up, and I maybe realize now that, oh, 10 years ago, I shouldn't have done that. It's okay for me to come up to my kid, doesn't matter how old they are, and say that, you know what, I remember that, and I realize now that that wasn't probably the best thing to do then. And I'm really sorry that I hurt you like that. And once you say that, because you're not, again, when we need to normalize these kind of exchanges, when we are accepting responsibility and acknowledging somebody else's pain, right? And when I am apologizing to you, my requirement is not that you forgive me. My requirement is that you know that I understand, and I hope that you're healing, and or you maybe have already healed, but I hope that you know that I understand this now. And you may forgive me, but you may take a little longer to get over it. That's fine as well, right? So it's important for me to kind of like, again, you know, express it in that way. Now, if I have restricted movement because of a lot of things, physical issues, or other resources, how do I go alone? Somebody has to take me, vagara, vagara. But we still have ability. Look at us using technology right now to reach out to each other, isn't it? Of course, we definitely want to hold hands and hug each other and look at ourselves in real life. But we definitely want to make do with what we have at different times of our lives, right?
Doctor, we have already crossed the time. So can we just wrap up if that's possible?
Yeah, I mean, that was my last point, that,
Yeah.
no matter what our circumstances is, if we figure out a good way of making it work for us, and that's why problem solving, and that's why asking for help from other people is concerned, that's more important, and that's great. And you know what? If I'm giving you an opinion or an advice, it's not necessary for you to take it. And I have to have enough confidence that it's okay. I think I should have contributed in this conversation this much. I did that. You take it, you make your decisions, because I'm all about empowering you. So if you take my opinion and advice and take that decision, great, but it's still your decision. If you don't take my opinion or advice and you take your decision, great, that's still your decision. So if I'm about empowering other people, I'm not going to feel bad if my opinion is rejected. So with that, I'm going to really thank you, all of you. And I did give you the disclaimer that I talk wax poetic on mental health.
Thank you so much, doctor. That was absolutely informative, wonderful session. As you can see on the chart, it's like very well appreciated. Thank you so much. And thank you all of you.
Hearing and
Just here
hugging is the
today.
best, I think. Hear and hug. That is the best solution.
Thank you. Thank you,
Thank you.
everybody. And we'll see you all tomorrow, 5 o'clock for the next session.
Thank you.
Thank you.
Bye.
Thank you
Thank
so much.
Thank you, Dr. Sayeda.